Wound assessment for nurses, part 1. A quick recap. In my previous video, I had talked about assessment of the past medical history, nutrition, medication, pain, nutrition, medication, and pain. So if you are working inpatient, you are a nurse who works in an inpatient, because we have the inpatient wound care teams and we also have the outpatient wound care team. Sometimes the assessment is a little different in the outpatient. So if you are working in an inpatient hospital, you have to also assess the risks for pressure injury. So things like activity levels, mobility levels, things like that. The patient continence status. You want to look into things like that. Those are pressure injury risks, which is mostly being done in the inpatient wound care setting. But in the outpatient, we really do not focus on the pressure injury, because this patient, they just come from home. We don't focus on the risk assessment for pressure injury, because this patient, they just come from home and they go back home. We can just give them a brief education about it, but we really do not focus on the Braden scale assessment skills. Wound assessment for nurses, part 1 continues. You want to assess the patient's nutrition. Look at their nutrition to see if they are nutritionally deficient. If they have poor appetite, they've not been able to eat well. If they've recently lost some weight. Assess for pain. Are they in pain? Because pain sometimes affects wound healing. Pain will also determine the type of dressing that you are using. Assess for fall. Are they at risk for fall? Because you have to bring in ideas to help them prevent fall if they are fall risk. If it means educating them to grab the bars when they are walking, or to get a walker, anything that will help them prevent them from fall, because fall will lead to more wounds, creation of more wounds. So you look into all this. And when I say to assess for nutrition, you know